This is a picture of a wilting plant, and in a moment, I will reveal to you what this has to do with fixing your thyroid problem. Hi there, I'm Dr. Raj Banerjee, and I want you to know that hypothyroidism is truly the most deadly silent killer. The health of your thyroid is the most important factor in your overall health, and hypothyroidism plays a direct role in the development of heart disease, cancer, and so many major diseases of today. I've been practicing over 14 years, and the hypothyroid story has not gotten any better. Actually, it's pretty much the same old sad story. Basically, what we have seen over the years is people like yourself, mostly women, some men as well, what most patients tell me is that at some point in time, they start to have some symptoms. Things start to occur in their bodies with their health, their daily activities, their quality of life, and things start to stack up. Problems like gaining weight and not being able to lose it, tired and fatigued, brain fog, achy joints, troubles with sleeping, all kinds of things, cold hands and feet. And so these symptoms are frustrating because the doctors may have said, well, but your lab tests are normal. And we're going to talk about that. See, the conventional medical system has people trapped and feeling like the medications are their only options. And yet those medications aren't addressing their cause. And that's what I want to show you. I want to show you why you still have the symptoms. Because if you understand that, you can also understand what you can do to help get rid of those symptoms by addressing their cause. Now, the thyroid is very important because what the thyroid does is it really impacts every cell in your body. That's extremely important. That's why thyroid problems can create problems like bone density, things like osteopenia and osteoporosis, and create problems with your joints like osteoarthritis, bone density, and joint pain. So that's one part of your thyroid. Another aspect of your thyroid is your immune system. Your immune system is very important and very connected to the thyroid. A lot of thyroid patients will have chronic coughs or chronic colds and not being able to fight off these things like they normally would have. It also has to do with your gastrointestinal tract, your gut. As you may know, your gut is very important for dealing with your immune system. In fact, upwards of 80% of your immune system is involved in the gut. And so when you have poor thyroid function, you can have poor gut function. So you can experience constipation all the way to diarrhea or even IBS. And so you get this downward spiral of symptoms as these functions break down. In addition to that, we also have the brain and the nervous system. Our brain and nerve system is very impacted by our thyroid function. That's why we see the brain fog, which can lead later to things like dementia, Alzheimer's, and Parkinson's. Your liver and your gallbladder functions are also connected with the thyroid. This is why we see 9 times more people having their gallbladder removed when they have thyroid problem. Also, the thyroid works directly in connection with your liver and your gallbladder. This can also impact your growth and sex hormones. This is where we see a lot of decreased libido. We see a lot of decrease in energy. It also deals a lot with our fat burning versus our fat storing. A lot of women will have problem with stubborn weight and belly fat. And so we see things where these hormones are basically tricking the body, and the same exercise and strategies that worked before just doesn't work anymore. And that's because the fat burning and fat storing hormones are imbalanced in your body. It doesn't let go of the fat like you want it to. Insulin and glucose metabolism is another thing that the thyroid works in conjunction with. So your thyroid, your liver, your gut, your adrenal glands, cortisol levels are all working together. Also the pancreas and your insulin and glucose metabolism. And so a lot of thyroid patients end up with long-term sugar handling problems, prediabetes or type 2 diabetes. Healthy cholesterol levels are another indication. When you have thyroid issues, you have to understand that many times we'll see the cholesterol begin to rise. See, these things are all connected because cholesterol levels are controlled and coordinated a lot through the liver and gallbladder that we talked about earlier as well. And so you can really start to see why the thyroid is so important, because so many systems work together with your thyroid and can have an impact on your health. Lastly, what I'm going to talk to you about is proper stomach acid. Acid reflux has become extremely common in today's world. And when you have a thyroid condition, you can have an increased risk for acid reflux. So the sad story is that most doctors are chasing all these symptoms with medication. No one is addressing the underlying cause of your thyroid problems. And so we see people becoming pre-diabetic. We see people ending up on cholesterol medications, acid reflux medications, antidepressant medications, because their doctor says, well, your thyroid is normal now, everything is fine. And you're looking at your doctor thinking, no, everything is not fine. You still have all the same symptoms. Maybe a couple of more symptoms came up. It's a trap. It's a downward spiral. And sadly, it frustrates a lot of patients. It frustrates a lot of spouses because they're there in the trenches with you. And unfortunately, they're hearing the doctor say, well, the labs are okay, and yet you're still feeling poorly. Do you think something is being missed? Yes, something is being missed. Stay focused and watch this whole video to the end, because I promise you, you'll discover what's being missed. By the time you're done with this video, you'll know why you're still suffering, even though your labs are still normal.
Hi, my name is Cheryl, and I started this program a month ago, and I've already lost 25 pounds, and it's the easiest program I have ever been on. I've tried all of them. I was taking 13 types of pills a day, which accounted to 30-something pills, and I am now down to 6.
In a month?
In a month.
Okay.
So I am so excited.
Good. And you lost how much weight?
25 pounds.
25 pounds. Okay, good.
Hello, my name is Deborah, and for many years I suffered from IBS for probably at least 15 years, and I was extremely frustrated about that, and I didn't know really what was causing it, and I wasn't able to sleep well, wasn't able to lose weight, no matter how much I exercised or whatever. I was very frustrated and was not able to get any results. So I decided to come to Dr. Banerjee, and he gave me some wonderful suggestions, and with those suggestions and with his program that he has, I've completely done away with IBS.
And how many weeks did it help
It
you?
only took a couple of weeks. Following his program and following his direction, I was able to alleviate those symptoms.
Okay.
And the sleep has improved, my energy level has improved, I've been able to lose some weight, and I just feel energized. I feel so much better.
Scott.
Okay. So tell me your experience.
I've been on Z-Grid for years and years because I've had a real horrible problem with acid reflux. And since I've been here and I've started on some of the medicine that has been recommended, or the vitamins, etc., and that's only been a week, I am not taking the Z-Grid anymore.
So how bad was your acid reflux?
It was horrible.
So,
I mean, really bad. I think if I missed like 2 days, it would get so bad, it would just start coming up, and my whole chest, the belly, the chest, everything would hurt.
Mm-hmm.
Just horrible pain.
Okay.
And I'm off of it already.
And how many days you've been in my program?
1 week.
1 week. And,
right.
And how long you been taking these meds for? How many years?
15 years.
15 years.
15
years of acid reflux, horrible acid reflux,
Horrible.
Gone in 1 week.
Right.
Okay, you excited?
Really.
Would you recommend this?
Tremendously
Would you
excited.
recommend this for other people?
Absolutely.
Okay, great.
Absolutely.
Great.
Program for thyroid problems and weight loss. And during this time, I've lost 38 pounds. I had a struggle with weight all my life. I was always a chubby kid. And after menopause, I put on a lot more. I never thought I would be able to take off all of this weight, but I really have been quite successful, and I'm very pleased with the program. And in addition to that, there have been some other problems that I had. I had a slight flutter in my heart, and I was taking some medication for that. I'm not doing that anymore. And also, I had a benign tremor, a motion in my neck and in my head, and that has greatly reduced. And finally, I was on asthma medication, and that medication has been cut in half. So I'm very pleased with that, and I would recommend Dr. Banerjee's program for weight loss for those who have thyroid problems.
Okay.